Hi, this is Dr. Tanya Olson, and this is going to be a demonstration of a standing hip abduction exercise that really targets the glute medius, which is the muscle that keeps your pelvis level and your hip and your knee and your low back safe when you're running. This is a really common area of weakness in newer runners or when people have run further than they're accustomed to doing. So I've got a band around my knees, and you want to have it as close to your knees as you can, but the higher up it is, the easier it is. So sometimes if you've got a little bit more weakness, you're going to start off up top, up higher, and so that you can actually perform this exercise a little bit better. So proper form is more important than anything. So band around the knees, you've got hands on your hips. There's a reason for this, because that helps you with your balance and proprioception. You're going to stand on one leg. Now, the standing leg, you should have just a micro bend in it, like 5, maybe 10 degrees, just so you have a little bit of play there, and that also challenges your balance and proprioceptions a little bit. So the goal here is you want to bend the knee that you're going to move, the leg that you're going to move, and the first iteration of this is you bend your leg, try to keep your thigh even with or just a little bit behind the standing one, and then all you do is bring your leg out straight to the side. Really try to avoid bringing the moving leg ahead of the standing one, because otherwise you're going to be targeting the hip flexors, but what we want to target is the glute medius, which brings your leg out to the side. If your legs are even with each other, or the moving leg is about 10 to 15 degrees behind the other one. So be really mindful of your form here, and you're just going to stand and bring your leg out to the side. So it's going to look like this from the front. And some things you really want to focus on is you want to make sure you're not tipping over too far or dropping your hip. And so if you notice that you're tipping over really far, that band might be a little bit more than what you need at the moment. And then the also thing you want to focus on is you only want to go as far as your hip range of motion is. So hip abduction is really only about 30 degrees. So you're going to go to about this far, and that is as far as your hip range of motion is. If you go further, you're getting into low back range, and then that's not what we're targeting. So you come out to the side, do that until you start to fatigue. Now you might fatigue first on the standing leg. You might fatigue first on the moving leg. Just go to fatigue and then switch your angle a little bit. So now you're going to start, so we were just out to the side. Now you're going to come like 45 degrees. 45 degrees. So that's going to be 45 degrees back and to the side, and really focus on not tipping over, keeping your shoulders even and being balanced and in control over that. Keeping the moving leg knee bent. So out 45 degrees to the side and back. Okay? Now the last one, you're just going to go straight back. And that's going to feel a lot more in your glutes and kind of give you a little bit of hope. Because hope is really important. So now you're just going to flex that foot, the moving foot, and just straight back. Try to keep your hips in line. Don't twist or do anything weird with your torso. Just straight back. And then you do this one until you start to fatigue a little bit. And then that's your series. So you go straight out to the side, 45 degrees, and straight back. And so you can either do all out to the side till you fatigue, all 45 till you fatigue, or all straight back till you fatigue. Or you can do side, 45, straight back. Side, 45, straight back. Really just depends on what's going on with you. So enjoy those resisted standing hip abduction exercise.